Please welcome to the stage, Delicia Haynes, MD, President and CEO, Family First Health Center.
Does my mic sound nice? Check one. I've always wanted to do that. So I'm Dr. Delicia Haynes. Oh, my clicker, that's what I need. Pleasure to be here. It's a whole different energy with us being together, and I've really missed that. Here. Trigger warning first. I should just be a walking trigger warning. Some of the things that I'm going to show might offend some people. Blame me, don't blame him. It's my fault. So I'm Dr. Delicia Haynes. I'm the founder and CEO of Family First Health Center, which was the first direct primary care practice in Daytona Beach, Florida. Started my practice as a fee-for-service, straight out of residency with zero business background, transitioned 6 years later to direct primary care. And I have to thank Hint because they have been with me every step of the way. So now I'm 6 years as direct primary care, a profitable and purpose-driven direct primary care system, and it's been a joy to see them grow as well. I'm also a coach, so I help other doctors, and I'm also an author, and I speak on physician suicide, actually, at medical schools across the country. And that's really one of the reasons that I transitioned to direct primary care was more for mental health reasons, because I knew what I needed to do to maintain my mental health, but I had no time to do it until I transitioned to direct primary care, and I absolutely love what I get to do now. So one of the most important things, the things that we don't have as physicians, is a safe space. And I started an organization called White Coat Safe Space, which was all about physician wellness and increasing awareness, advocacy, and prevention of physician suicide. So this is the audience part where I do need your help, because I do need you to agree to some things. No rules, but just some agreements. So the first one is there's no judgment. And you do have to raise your hand that you agree not to judge yourself and not to judge your people. No one is raising their hands. Okay. All right. No, this is serious. Because we don't always have that. And when we talk about inclusion, when we talk about DEI initiatives, one of the things that makes it difficult to talk about is because we don't create a safe space first. We don't create a space where it's okay to disagree, where it's okay to have a different opinion. And that's really important. The second agreement is no repercussions. So whatever is said here stays here. We've all had that experience, hands raised. Thank you. That we say something and somebody goes back and they talk. And for those of you who are considering transition to direct primary care, and maybe your employer doesn't know, you might not want someone to go and talk about it. So no repercussions. And then the last one is unconditional respect, that no matter what you say, no matter what someone else is talking about, that you're going to promise to show them unconditional respect. I need 100% of hands raised. Nudge him. This guy. Thank you. Okay. All right. So we can move on. So I know that the topic that is in the program is about our personal biases. And to be honest, to try and do that in this environment in 20 minutes is disrespectful to the topic. However, I do want to make sure that we spend some time on it. And if you would, feel free to take out your phones and take a picture wherever is it over here? Wherever the screens are. This is one of the tests that you can take to kind of uncover your implicit biases. And I would recommend that you take it and that you remember the 3 agreements, especially the one about no judgment to yourself, because when I took it, I remember thinking that I thought I was more self-evolved. And then it brought to light some things, some thoughts that I wasn't aware that I had, and then some that I knew. Like there's some biases that we know we have. In medicine, oftentimes we think of our profession as this always noble profession. And I sit on a lot of boards, and one time in 2020, I was on a board, and I wanted us to come up with a statement. And one of the board members said, "Well, we're doctors. Of course everyone should trust us." And I realized in that moment that he and I came from very different backgrounds when it came to our profession. For him, it was the profession that was noble. How about now? Better? Better? Yes? No? Not at all? Okay, we're gonna try and roll with it. So he came from a background of this is the noble profession, and we're always doing things in the best interest of our patients. And I recognize that, yes, it is a noble profession, but we're also the profession of Dr. Sims, who performed surgeries on enslaved African American women so that he could do without anesthesia, and then opened up a hospital in New York to take care of white women where he used anesthesia. That's also our profession. We're also the profession that during the Holocaust, we were responsible for experimenting on Jewish individuals. And then in my lifetime, because although I may look like a millennial because of Botox, I'm actually a 70s baby, that the Tuskegee experiment, which ended in the 1970s, where African American men were denied treatment, although we had a cure, because our profession wanted to see what would happen if they weren't treated. And we had to take all that into account, because sometimes people say, I don't know why people don't come and they don't trust me. Well, maybe it's because they're smart and there's reason why they historically have not. And so it's up to us to make sure that we are looking at our own biases, that we're looking at our own history, and that we're trying to make a more inclusive environment. So I have my own biases, and growing up in the South, one of those is a certain flag. It's not the rainbow flag. It's a different flag. And when I see it, I actually visibly cringe. And I was pulling into a parking lot, and I was jamming out to my 90s, hip hop music. And then I see this flag hanging from a truck. And all of a sudden, my third grade self was back in Charlottesville in the heat of the summer. I'm thirsty, but I'm not allowed to drink from the glass. So my friends tilt the glass, and I tilt my head and I lap like a dog. And I let the water go over my eyes so they couldn't tell that I was crying. And usually if I see that flag, I'm going in the opposite direction, but this time that flag was right in front of my clinic. And my MA sent me a text message and said, hey, you need to get in here quick, it's about to pop off. And I made sure that she was okay, and then I said, okay, I'm just gonna sit here for a minute. Because that same safe space agreement that we just went through, I knew I needed to take myself through because I needed to take care of that individual who I was very triggered by. So I walk into my office, and on one side of the room, I have my established patient who has been a leader in the Black Lives Matter movement and protest in our community. And he is seething, like if looks could kill, he would have killed my new patient, who was sitting on the other side filling out new patient paperwork. And I greeted both of them, and then I went up to my established patient and I said, so how's my favorite fisherman? Because I've been giving him the prescription to go fishing more as a treatment for his blood pressure in addition to other things. And his complete face changed. He took out his phone, he started showing me everything that he was, that he had caught. But I didn't do it because I'm interested in fishing, because I'm really not. I had noticed that the other man's truck had fishing poles in it. And sure enough, as he's whipping out his phone and he's going through his fish, the other guy kind of gets up and can I see? And he comes over, and next thing you know, they're in this lively conversation about what bait they're using and where they're going and all these things that I don't know a whole lot about, to be honest. And so I say that because there's always a story behind. And so that the next time I saw that patient, he came in, my new patient, well, now he's established. He came in and his blood pressure was his systolic was in the 200s. And I was like, what happened? And he said, I got heckled on the way here because of my truck. And he told me the story of why he uses the flag. He was raising his granddaughter, and he told his granddaughter, if you stick up for yourself and you do what you believe in, I'll be proud of you. And she said, well, your grandfather, your great-grandfather that fought for the Confederacy, was he fighting for what he believed in? And he said, yes. And she said, is it okay to be proud of him? And from then on, he started waving that flag. And it has Pappy on it, which was the name of their great-great-grandfather. And I listened to this story and I said, I understand why that's important to you. Is it okay if I share with you why it doesn't mean the same thing to me? And I did. And he still flies the flag all over town, but when he comes to my clinic, he doesn't. And it's not because I told him not to. It's because when we got out of each, I'm repping this hood and I'm repping that hood, and we actually got to talk to each other as people, and he recognized me, and we have a relationship now, that he just didn't want to do it anymore, not to hurt me. And the beautiful thing about direct primary care is that we have a chance, we have the time to actually sit there and listen to the stories and understand what's going on behind it, because we may not know the story, but there is always a story, and things are not always what they seem. He chose me as his physician because I had bucked the system and because I was doing something that I believed in. Now, that is not what I had no idea why he chose me. I was like, you are lost. But when you take the time to create respect and connection, amazing things happen. And there's a lot of different ways that you can go about being more inclusive. And I think it's important to be inclusive in every sense of the word. Before I go on to that, though, it's also important to just to recognize, again, our personal biases. I sat there for 5 minutes, not because my MI wanted me to, because she wanted me to run in, because I recognized that I had to work out what was going on internally with me. And we all have triggers. If somebody calls me a rich physician that you don't know how the other people live, I get a little bit triggered. And it's up to me to work through that so that I can take care of them effectively. And we always have to understand what we're working in. I gave a similar talk before, and we talked about the movie Single White Female. And I don't know how many of you are old enough to remember that movie. But it was a very effective title because it conjured up everything that our society has said we need to protect, something that's fragile. And there was somebody in the audience who was not from the US, and he said, is there a movie called Single Black Female? And they were like, no, she's strong, she don't need help. And that's part of the problem. Because when we look at our health disparities, and we look at kids who have sickle cell, who are African American, they don't get offered pain medication. When we look at women like myself who are college educated, I've got a 5.2 times greater risk of dying during childhood, not because of lack of education, not because I don't have finances, but simply because of the color of my skin. And it's not all nefarious. There are some things, like if I lose 5% of my blood volume and my wonderful colleague Julie Gunther loses 5% of her blood volume, she's going to look bad first. My melanin, if you're not looking at my hands, at my conjunctiva, if you're not looking, you might miss it, but I'm just as sick. And by the time you see it, it's too late. So we have to make sure that we are broadening and that we're looking for those things. So I'm going to go through now some practical things you can do to make sure that you're more inclusive. And we're going to go through the 5 senses because I like to keep things really easy. So the first one is the sense of touch. Nowadays, there are so many different ways that you can get in contact with patients. If you have a CRM, if you've got MailChimp or whatever you use for your email services, that you can tell your patients after they sign the contract that they didn't read, that what to expect, coming up. They're not going to read it. So it's up to us to make sure we're reinforcing, hey, if you contact me, you can expect a call back within this X amount of time, because people get upset when their expectations are not met. It's our job to make sure the expectation was properly set. We also have patients, though, who are literate. So our emails are very ineffective for them. And so we have to make sure that when we think about who we're taking care of, that we are coming up with ways that we can get in contact with them, that we can connect with them. And again, it's all about respect and connection. Taste. So it's really important that you give someone an opportunity to realize what style of medicine you practice. So I do a lot of lifestyle medicine. If you come to my office with your soda, I am going to dump it out. I'm going to put it down the drain. I'm going to give you some water. And then I'm going to make it part of my display. Everyone knows now. Now I wait until the second visit, because the first visit there was no rapport and it didn't go over as well. But you want people to really understand like what they're signing up for. Like, what kind of doctor are you? Are you a pill? There's a pill for every ill type of doctor, or are you someone who like you're about to work? They need to know. Smell is one of those things that you want to make sure you're going easy on. A lot of people love aromatherapy and all of those things, and I think they're fantastic to an extent, but they can be overdone. If you have patients who have, a seeing eye dog or any serviced animal, obviously they are very sensitive to these smells, so we don't want to do it. And the most important smell is the clean smell. Because people, when they come to their office, they can't tell how smart you are. They can't tell if you were the head of your class or if you kind of just made it through. But they can look around and see if you care about your environment. So this is my waiting room. It's not super fancy. There's no like chandeliers hanging, and there's definitely no disco ball. And if my roofers were to come in with their dirty shoes and see chandeliers and disco balls, they would feel out of place and they would feel uncomfortable. So you want your environment to be really created, for its purpose and the people that you want to connect with. One of the other things in direct primary care is that a lot of our waiting rooms look very like living rooms, which is nice, but it also still has to be functional. A couple of years ago, I went to visit a group that I was coaching, and I went and I sat on their couch, and this whiff of urine came up. And I was like, oh man, I was on my way to a date, like, this is not gonna work. And they had been trying to get the smell out. They had this really beautiful upholstered, furniture. But we have to make sure we understand that, like, we examine every orifice, and sometimes they leak. And so our environment needs to be something that we can easily clean. And then again, with these chairs, people who have orthopedic problems, they need those handrails to be able to push up on, to be able to get up out of that soft seat. And then our patients who are obese need to not have the rails so that they can actually sit comfortably. So really taking those things into account so we can create a more inclusive environment. The other is sight. It was very welcoming to see all of the banners as we were coming and walking into this building that represent both Black Lives Matter, transgender, LGBTQ. And you can put those on your website, if you choose. I actually don't have any of those banners on my website, but I am very intentional about the pictures that are chosen. So a few years ago, one of my patients who is Hungarian helped out with my social media, and all of a sudden I noticed that everybody had like brunette or blonde hair, and that was like the extent of diversity. And I'm not from Hungary, so I don't know what the Hungarian environment looks like, but it was definitely not reflective of the environment that of the people that I take care of, and I just brought it to her attention. And it wasn't, she didn't do it on purpose. She's from Hungary. So she just chose pictures that, these look like patients. And when I brought it to her attention, she was able to change that. So making sure that you look at your website, you look at your social media, you look at what you're doing, and you ask the question, who's missing? I have the opportunity to serve on a lot of boards, and that's exactly what I do when I'm thinking about who needs to be on the dais, especially in the direct primary care community, because sometimes we see the same group of people, and we're looking at, are there MDs, are there DOs, are they old, are they young, is it rural, is it urban? Do we have people who are LGBTQ? Do we have people who are tan? Does our movement reflect actually the people that are in it, and making sure that it can? So this is one of the ways that you can be more inclusive about your environment. And then sound is really important. So I had a day where all of my new patients were gay. And I was like, this is cool. Did I like pop up on some like website or something? Like, what happened? And really, they just said, we were looking, for you. And we went on and we heard your talks, and we could just tell by your vibe and just who you are that I was going to be accepted here. And so we can use our YouTube channels or videos for people to get an idea of who we are and who we're not, because we're not for everyone. I'm very clear that there are certain patients I don't do well with. I'm going to annoy you. You can stay if you want to, but I'm not going to change. So you need to know what you're signing up for. And so sound is a really important way that we can let people know who they're getting involved with before they actually come in. And it's interesting because when they come in, they feel like they already know you, and they're like, pronounce your name right, and then you're tripping out because you're like, do I know? Am I supposed to know you? So that's one of the things that you can really do to really make your environment more inclusive. Because when it comes to direct primary care, we're providing care directly, but it doesn't change who we are. We come in with all of our direct biases. We come in with all of our direct thoughts. This is a picture of my mother. My mother had an abnormal pap smear, and she was taken for surgery. My mom was very humble. She didn't tell the surgeon that her daughter was a doctor. And when I got there, they went for surgery, and they never did an imaging study. And so they opened her up, and they realized it's metastatic, stage 4. And they closed her up. And then she had complications from a surgery that was never needed. When I got there and I walked up to the doctor, and I was like, where's the imaging studies? Like, what happened? And he hung his head and he said, she just looked so good. My mom is no longer with us. Now, she probably would still no longer be with us even if the surgery hadn't happened. But the pain that she went through because of it could have been avoided if the doctor didn't just look at her and say she looks good. And so I bring that up, just to throw back to what we were talking about earlier, that we have to expand and ask ourselves, why am I offering someone this treatment and not this one? Why am I saying that this person can do this more expensive treatment, but I'm not offering it this person? Is it our own personal bias? Because our own personal bias in healthcare can really be detrimental. But before you go out and you start taking care of other people, the first person that you have to take care of is yourself. So I love that there's a Lisa Nichols quote that goes along with this picture that says, fill your cup, serve from your overflow, which is something that I aspire to do. And there's also a sermon by Charles Stanley called Halt, which says to never let yourself get too hungry, angry, lonely, or tired, because we make terrible decisions at the extremes of all of those. And so I implore upon you that one of the reasons it's hard for us to be compassionate is because we don't take care of ourselves properly. And that it is time that you put yourself first, that you fill your cup, and that when you're serving other people, including your patients, that you're not serving them from what's in your cup, which is for you, but from your overflow, which is for them. And that's when you never run out of compassion and care because you stay full. And in closing, I just want to say a quote that one of our patients gave us, which I thought was one of the best quotations ever. And it was that you gave me a place where I could be myself. And when we expand and are more inclusive and are intentional about it, we give other people a chance for them to be themselves and for us to be ourselves. Thank you.